Welcome to my channel Medicine Guide. Levetiracetam, Keppra, is a novel antiepileptic drug used to treat partial, myoclonic, and tonic-clonic seizures. In 2000, the FDA approved the use of the oral formulation as adjunctive therapy for the treatment of focal seizures, myoclonic seizures, and primary generalized seizures. In addition, the FDA approved intravenous levetiracetam, Keppra, in 2006 for use in patients older than 15 years as adjunctive anticonvulsant therapy when the oral formulation is not tolerated. The mechanisms by which levetiracetam exerts its antiepileptic effects are not clearly defined. However, the most relevant mechanism of action is believed to be binding to a unique synaptic vesicle protein 2A, SV2A. SV2A protein is a part of secretory vesicle membranes that mediates calcium-dependent vesicular neurotransmitter release. The binding of levetiracetam to SV2A appears to decrease the rate of vesicle release. In this video we will discuss some uses and other pharmacology of levetiracetam, Keppra. Uses or indications. In Europe, it is approved for treating partial seizures as a single agent and as an add-on treatment for partial seizures, tonic-clonic seizures, and myoclonic seizures. It is chemically unrelated to other antiepileptic drugs. However, its favorable safety profile, distinct mechanism of action, and fewer drug interactions make it an attractive therapeutic choice for treating seizures. Myoclonic seizures. It is approved for adjunctive therapy in treating myoclonic seizures in adults and juvenile myoclonic epilepsy in adolescents 12 years and older. Partial seizures can be used as adjunctive therapy for treating partial seizures in adults and children 1 month or older with epilepsy. Primary generalized tonic-clonic seizure. Levetiracetam, Keppra, is used for adjunctive therapy to treat a primary generalized tonic-clonic seizure in adults and children over 5 years old with idiopathic generalized epilepsy. It is sometimes used off-label, non-FDA approved, for status epilepticus and seizure prophylaxis in subarachnoid hemorrhage. Levetiracetam, Keppra, is also used off-label for the prophylaxis of traumatic brain injury, TBI, and supratentorial neurosurgery. Levetiracetam, Keppra, is also used off-label used for seizures in palliative care. Administration. Levetiracetam, Keppra, is available in oral and intravenous, IV, formulations. The total daily dosage of IV levetiracetam, Keppra, is equivalent to oral. It is administered as a 15-minute infusion. There is no evidence to use a loading dose. In addition, oral forms are available in immediate release and extended release forms. The bioavailability and metabolism of the extended release form are similar to the immediate release formulation. However, the time to reach peak plasma concentration is 3 hours higher with the extended release formulation. Adult dosing. The minimum recommended dose is 500 mg twice daily. Some older adults may respond to doses as low as 500 mg daily. It should be started at a low dose and titrated for clinical response. Increase the dose to 250 or 500 mg at 1 to 2 week intervals until the clinical response is achieved. The maximum recommended dose is 3,000 mg per day. Rapid dose escalation can lead to adverse effects. An immediate release form is dosed twice daily, and extended release forms once daily. A therapeutic serum concentration is not established for levetiracetam, Keppra, and dosage is guided by clinical response. Efficacy of more than 3,000 mg per day dose is not fully established. Some suggest that the dose can be increased up to 4,000 mg per day in patients who have shown clear response but have occasional breakthrough seizures. However, some reports of seizure exacerbation with higher doses, and the physician should keep that in mind while using higher doses. Levetiracetam, Keppra, is conventionally given as an intermittent infusion to mitigate potential adverse drug reactions due to its acidic formulation. However, the time lag in the preparation of diluted levetiracetam, Keppra, can delay the treatment of status epilepticus. Hence, a recent study examined the administration of undiluted doses. Results demonstrated that rapid and undiluted intravenous levetiracetam, Keppra, is safe and effective. Hepatic impairment. Dosage adjustment is generally not needed for hepatic impairment. However, there are reports that total body clearance of levetiracetam, Keppra, is reduced by half in severe liver disease. Therefore, half of the recommended dose should be initiated in patients with severe liver cirrhosis. Renal impairment. Levetiracetam, Keppra, is excreted through the kidneys, so renal impairment decreases the elimination rate, necessitating dose reduction. Pregnancy considerations. According to manufacturer labeling, marked pharmacokinetic changes during pregnancy are particularly observed during the third trimester. Current studies cannot definitively establish the absence of risk, and the literature review has not demonstrated an association between levetiracetam, Keppra, used during pregnancy and major congenital disabilities or miscarriage. However, significant differences in pharmacokinetics during pregnancy have been observed for levetiracetam, Keppra. Average peak clearance increased by approximately two-fold for levetiracetam, Keppra, from a non-pregnant baseline. Breastfeeding considerations. Manufacturer labeling indicates that the developmental and health benefits of breastfeeding should be evaluated, along with the mother's clinical requirement for levetiracetam, Keppra, and adverse drug reactions in the breastfed infant. Levetiracetam, Keppra, is excreted in breast milk, but infant serum drug levels are low. However, the levetiracetam, Keppra, concentration in milk can be high in some women and sometimes cause sedation in breastfed infants. If the mother requires levetiracetam, Keppra, it is not necessarily a reason to stop breastfeeding. However, clinicians should monitor exclusively breastfed infants for developmental milestones, drowsiness, and weight gain. Evidence indicates that levetiracetam, Keppra, might decrease the maternal breast milk output in some women. Therefore, maternal serum level monitoring and dosage adjustment are recommended in the early postpartum period if the mother was administered levetiracetam, Keppra, throughout pregnancy and breastfeeding. That's a no for this video. If you want to watch more videos like this, please keep watching my channel. Disclaimer. Channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share, and subscribe to my channel Medicine Guy.